Good evening. I will now call to order the Clarke County Regular School Board meeting, July 26, 2021. Please rise for the Pledge of Allegiance. Oh, should I need to do the other thing first? Katie, is this okay? Okay, sorry. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Sorry about that. Ms. Kerhobert is not able to join us in person and wanted to join by via phone. So may I have a motion to approve?
I would move to approve Board Member Katie Kerhobert's participation by electronic means from a remote location.
Second?
All in favor?
Aye.
All opposed? Okay.
I'm sure it's a remote location with lots of sand and water.
I'm sure. It's her favorite.
Hopefully she doesn't answer from there.
Hello?
Hey, Katie.
Hey.
Okay. We are in session.
Okay.
Okay. Any questions about tonight's agenda?
No, I would move that we accept the agenda as presented.
Second?
Any further discussion? All in favor?
Aye.
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 All opposed? Approval of consent agenda. Any questions about the consent agenda?
I'll move to approve that as presented as well.
Second?
All in favor?
Aye.
Aye.
Okay.
All opposed? Okay. Superintendent's update. Dr. Bishop.
Just a few items for you this evening. Let me get to the right screen here. So attached in the information tonight is information related to new growth assessments that are required by the Department of Education for the coming year. And ultimately what this means, and I'll go over this as much or as little as you would have me go over it, but ultimately what this means is for the next year, in the fall and in the spring, students will be assessed on state assessments, computer adaptive testing assessments, and the growth of those students throughout the course of the year will help to determine what our accreditation status is. So it takes a student from where they are and where they've grown throughout the course of the year, and that will be a part of the accreditation process in the future. And that's grades 3 to 8. The following year, there are 3 assessments: fall, mid-year, and spring. And of course, the spring assessment is the regular SOL test. So there's a lot of slides there. I'll have Mr. Schubert come, or Dr. Schubert come in the fall and do an update on this in more depth and detail. I actually pared down these slides to 17. There was about triple that amount, but this gives you the basic information related to the growth assessment process that will be implemented in the coming year. So for a student in grade 3 reading, let's say, they will be assessed on grade 2 content. Grade 4 reading would be assessed on grade 3 content, etc. To find out what they know and what they're able to do in terms of the assessment, all the way through 8th grade. So again, if there are other questions, I'll have Dr. Schubert come in the fall and do an update for you and go through this process just as he has in the past with test scores, etc. And if you have any questions in the meantime, reach out. But I wanted you to have at least this bit of information prior to any start to the year. A June food service report from Sodexo is also attached as information. Our food service staff continues to work throughout the summer as they did throughout last summer. This past month we served 17,764 meals, and total served over the year 388,000 meals. As a reminder, the USDA did extend the free meals for all through the remainder of the coming school year as well. So all students will eat free regardless of their socioeconomic status. We've entered into an agreement with Family Preservation Services to provide therapeutic day treatment in our schools. This is not new. We just did not have it last year as a result of COVID. So that agreement is set to start on August 1st of 2021. We did receive a SSO incentive grant for school security officers. That grant is in the amount of $70,000, although that's about $40,000 worth of the 70 we're responsible for because it's based on your composite index. We will have a school security officer at both Boyce and Cooley next year, and we'll discuss it further during the personnel portion of tonight's closed session. Updated return to school. I'm sorry, go ahead.
Will we still have school security officers at Johnson Williams and the high school?
Yes, we will. Mr. Smith and Mr. Kidrick will remain at CCHS and Johnson Williams respectively. Updated return to school guidance from the Virginia Department of Education and VDH is attached. The updated guidance was released last Wednesday. I was out of the office last week, so I started going over it today. Just a couple of things to mention as part of this portion of the report. On July 9th, the CDC released their guidelines for the 21-22 school year. And then, as I mentioned last Wednesday, the Commonwealth also issued updated guidance. Governor's order expired on June 30, as you know, and the health commissioner, the order that he had put forth expired yesterday. There is some conflicting information between the CDC and their recommendations and the Virginia Department of Health and Virginia Department of Education. One example of that is with respect to mask wearing. The CDC recommends that any unvaccinated person, ages 2 and above, in schools would wear a mask. The VDH recommends that elementary staff and students wear a mask, and that masking would not be required of staff or students at the middle or high school level who have had the vaccine. So we'll have to, it is more of a local decision this year. Both sets of guidelines recommend a layered approach to bringing students back and stress the importance of returning students to in-person learning. Several things to consider. Safety, of course, is always of utmost priority. Universal masking has not been required for several months now, with the exception of school buildings. Reintroducing masking could be tough to enforce. Differing opinions, as I mentioned, between the CDC and Virginia Department of Health. Requiring some vaccinated staff to wear a mask while others are not required. And then how do we verify a person's vaccination status? I'm actually going to place a call to our attorney tomorrow to find out how we can go about verifying vaccination. I would like to present a draft return to school plan to you on August 9th during the work session. But until then, we will continue to monitor the situation related to COVID over the next 2 weeks as we put together the plan. As we all know, there's the variant is out there right now that appears to be fairly contagious, although the vaccine seems to be helping for those who have been vaccinated. We would encourage everyone eligible who is in good health to receive the vaccine. And the VDH website now has vaccination rates. So I went in today and took a look. The state total population with one dose, 59.7%. Adults, 71.6%. Percent across the state fully vaccinated. Total population is 53.6, and adults only is 64.7. In Clarke County, total population with one dose, 55.3%. Fully vaccinated, 50.4%. When you look at adults only, one dose, 64.9%, and fully vaccinated is 59.4%. You can go down a little deeper into the data and look at age bands. 32% of our individuals between the ages of 12 and 18 are fully vaccinated currently. and 45% of our high school age population is vaccinated. And I just got off a conference call with Dr. Green just a little while ago. We finished up about 5:45, and Clarke has one of the highest vaccination rates among that school age band of anybody in the area in the Lord Fairfax Health District. Also, I've communicated this morning with a contact at the health department, and we're looking at another vaccine clinic and offering that as teachers prepare to return to school. We're looking right now at August 19th, but that has not been confirmed yet. We do have a number of new employees next year. Some may have received the vaccine in other localities, and others might want the vaccine but haven't had opportunity for whatever reason. So we'll try to offer another clinic as we start the year. As you know, last year we offered 4 or 5 clinics as a school system, and we're happy to do so early on. By February, we had about 70% of our staff fully vaccinated, and by the end of the year, we were close to 80%. So I think that's it for this evening.
So, so we have a work session August 9th. So that will definitely focus on our reopen plan. So I know Dr. Bishop's gonna, as he just mentioned, he's gonna kind of put together our plan, and then we'll, I suspect we will have a pretty detailed discussion about it. So we would just ask everybody to tell all your friends that the August 9th work session is happening. If they have questions, concerns, please make sure you go to Board Docs, read the documents that Dr. Bishop's going to provide, and then hopefully we will be ready to go. I think August 30th, isn't that the date? 31st, that date too. Okay.
So will there be anything that we need to vote on, and we'll because the next meeting is August 23rd.
You can't formally vote
Right.
at a work session.
Yeah.
So any feedback that you might have, that would give us an opportunity to incorporate that feedback and then have a final vote on the 23rd.
Okay.
and
I'm
like
just
we
was going to ask if there might be, if we might want to consider like having that meeting where we vote a little bit earlier, if there's anything that parents, want to know like more than a week before. I don't know. If there will be.
I think we'll have special meeting if we need to, depending on
Okay.
our conversation. Yeah, absolutely.
Okay.
Just kind of do what we did last year, right?
From my perspective, I
I
think,
hope not, but,
from my perspective, I think the big item that has to be decided is the mask issue. In terms of contact tracing and those kinds of things, there are a few minor changes that are recommended. But we know now that if you've been vaccinated, you monitor symptoms. You don't have to quarantine. Or if you've had COVID in the last 90 days, you monitor symptoms. You don't quarantine. So we know a lot more now than we did a year ago. So the big question is going to be to mask or not to mask.
Yeah.
I like that Shakespeare reference, don't you?
yeah.
Okay.
Okay.
Thanks.
Thanks, Dr. Bishop. Okay, audience comments. Audience comments are limited to 3 minutes per person. Those wishing to speak should fill out a speaker's card with the clerk. Ms. Weir? Katie, can you hear okay?
Yes, thank you.
First speaker to sign up is Henry Schmidt.
You do have a copy of Mr. Schmick's comments at your seat.
Katie, that's the picture I just sent you.
Okay, thank you.
Hello, thank you. Yes, my name's Henry Schmick. I'm from White Post. I was a little surprised a couple of weeks ago reading in the paper about the proposed change to switch from blocks to periods, and I would like to request we don't do that this year. That's the final request. But before we get there, I'd like to start with saying congratulations on getting through COVID year, or maybe years. Congratulations, it's been a fantastic job. It's really been a big impact on all of us. I'd like to mention the entire staff down through the janitors have done a fantastic job. So give yourselves a pat on the back, but we have a little bit more to go. Context switching. That's just what I did. I started out talking about a request, then I switched to congratulations. Now I'm context switching, multitasking, And that's what you're asking the students to do if we switch back to 8 periods. It's a lot more context multitasking. Cognitive load, we just did context switching. We just switched from one topic to another. They have a load on them. They're not just using what they already know. They have to learn new things, consolidate them, and then use them right away or the next day. So they have a much more cognitive load on them. The alternate day, the A-B plan, is a lot better for them. When you think about having 8 classes a day, and you think about tests and quizzes and papers and handouts, the workload and the scheduling is just going to be a lot more intense. Going back to school was going to be a stressful event. Why are we going to make it more intense for them? What I also labeled this was block or period scheduling follow the sleep science. Alternate days gives you more time to sleep between classes. Why is sleep important? More and more the sleep scientists are finding that your memories are consolidated while you sleep. Not only are your memories consolidated, but it gives you time to organize things, get rid of old memories that aren't needed, and to focus on the things that are needed. Sleep is incredibly important. So in closing, I'd also like to float a new proposal, again based on sleep and sleep science. New proposal is we keep the block schedule, but if you want to make a change, let's start at 9:05 instead of 8:05. There's a lot of good science that says that does make a difference. On the back of this sheet, lots of good science. You could also come up with lots of references saying all kinds of marvelous things. But I really would stress, this is going to be a stressful year for the kids. They've had good virtual experience, but now it's time to come back to in-person classes. Let's not make it any more stressful for them. Let's not change the system they're used to, block scheduling. Let's keep block scheduling this year and think about it maybe for another time. Thank you.
Thank you.
Thanks.
Next speaker is Daniel Vaught.
Thank you for this opportunity to speak. My name is Daniel Vaught. I live in Berryville, and my son will be attending first grade at DG Cooley this year. I have emailed some of you, Dr. Bishop and also Ms. Kerr and Hobart on the line, so it is good to place some faces with some names there. And I've also provided some copies for you as well with extensive citations. Tonight, I urge the board to recommend a mask optional policy for students and staff. Before I note the reasons why, I want to emphasize that I'm not a COVID denialist or anti-vaxxer or anti-masker. I have been vaccinated. I'm eager to vaccinate my son. I've dutifully worn masks, and I've put masks on my son. I stand here simply as a parent looking out for the well-being of my son, families, and teachers. Here are the reasons why I oppose a mask mandate. 1, Clarke County's cases, hospitalizations, and death rates are very low. Despite small surges elsewhere, Clarke County's cases have remained very low with less than 20 daily new cases since February 1st. Hospitalizations are very low, with 2 or less daily hospitalizations since February 11th. And there have only been 3 recorded deaths from COVID in the last 5 months. There's been 0 hospitalizations or deaths for children. Why would we mandate masks in such a low prevalence environment? 2, school mask mandates provide little to no benefit. Studies of school districts with and without mask mandates show little to no correlation between mask mandates and COVID-19 rates among students. A recent CDC study showed a 0.003% benefit to total student COVID case rates. 3, mask mandates may be harmful to students. Lip reading is an important part of language development. For early readers, mask muffles word sounds critical to reading development. And there is the constant trauma that students will be reminded of all day with a mask mandate. They will be marked as unvaccinated, germy, dangerous. Haven't our children been traumatized enough? 4, children are not a significant risk from COVID-19. One of the blessings of COVID-19 has been that children are low transmitters of the virus and have extremely low risk. A recent study found that children's risk of severe outcomes was 0.00002%. Why would we mask children when they're barely at risk? 5. Vaccines for children may be significantly delayed or not even authorized. Proponents of mask mandates have argued that we will just do it until they get vaccinated. However, the FDA is already projecting a delay until midwinter, and it'll need an EUA, which the FDA advisors are split on. Is there an off-ramp for mask mandates if vaccines are indefinitely delayed or not even at all? My last reason is personal. I'm worried for my son. He cries at the idea of being required to wear a mask for 7 to 8 hours a day, all school day. It demeans and hurts him, traumatizes him. School should be a joy for him, and it's heartbreaking to think that school may be so terrible for him instead. Please allow for a mask optional policy. Thank you.
Thank you.
Thank you.
The last person I have signed up is Michelle Worthing.
Hello. I had been going to ask about the vaccination rate of teachers and staff, but Dr. Bishop pretty much answered that. He said it's 80%.
And at the end of the year, we were
Is
at
that
80%.
teachers or
That was
teachers
full
and
staff.
all staff?
Yes,
So, and I wondered, do you track it? Do you know who is and who is not?
self-reported.
Self-report. And you are still encouraging the rest of them to get. Okay, that was, thank you.
Anybody else? Would anybody else like to speak? Oh,
Do I need to sign up first?
no, it's okay.
Okay. My name is David Moore, and I have 3 children in the high school. And I just wanted to speak, I guess, to the emotional and psychological aspect of the masks. In all honesty, the teachers have done a great job. The school has done a great job. It's been a very hard year for everyone. And I do feel that getting back to normal is going to greatly give us a better academic year. If you look at the federal reports as far as how well the students have done this year, we're talking about from 20% of students having an F in a state to now 46% having at least one F. It's been a very difficult academic year across the nation, across the board, in Virginia and in the high school. My children come home and they tell me about how some students will say, well, if I don't pass the class, it's okay because they can't fail me this year. I'll move on to the next level of English, even if I fail the class. Even if I do this, it's fine, it's COVID. It'll just be washed away, it's fine. Getting back to psychologically normal, back in school, getting the masks off is going to greatly improve their outlook on study. That's a year that's gone. We're on to something new now. We're back to normal. So, I mean, even my own children will say how sometimes they'll be sitting around in the gymnasium. PE was not happening this year. It was sit around, play cornhole most of the time. Again, teachers did great. That's just the position it was. And the teachers would be sitting there without their masks on or their mask down, telling the kids to put their masks on. And my kids came home several times with that happening. So not only is it difficult for the teachers to keep up with it, students to keep up with it, is it really serious? Do they need to do it? Do they switch masks in elementary school? I heard of kids switching masks to have a favorite mask. All I'm saying is, if we can get back to a normal face showing in class, the psychological aspect of that will greatly improve back to normal, higher academic output, which is what we're all about. So, thank you.
Thank you. Okay. Consideration of policies, second reading. The school board approved the following policies on June 21st, 21. For first reading, a second reading and adoption is recommended. The 3 policies are listed there. Any questions about these policies?
No.
May I have a motion?
I move to approve the policies and regulations presented for second reading.
Is there a second?
Second.
Any further discussion? All in favor?
Aye.
Aye.
All opposed? Okay, school board member comments. Mr. Schutte.
I'm happy to be going back to school. I don't claim to be an expert on sleep or some of the other things. I am just happy that we are planning on moving forward and getting back to school. We'll work on the details, and I'm very confident that the staff has been working on the details. But I'm very happy that we're moving on to a new year and actually going to be open and having discussions about whether masks are mandatory or partially mandatory or whatever it is, rather than the alternative that we're going. So I'm just happy that we're moving on to the next thing.
Ms. Ryan.
Same. I'm happy that everyone's coming back to school every day this year, and that we just have some details to work out. Also, really happy to see how many young people have chosen to get vaccinated, and I hope that more people see that their friends got vaccinated and they're fine and they can do it too. And I think everyone's ready for normal, and the best way to do that is to keep getting those vaccines into the unvaccinated folks. So looking forward to our discussion on the 9th, and thanks for the work you've put in so far.
Ms. Kerr-Hobart?
Yes, thank you all for letting me call in tonight. I wanted to say congratulations to our girls soccer team for winning states. I think that our last meeting was just before that happened. And then also congratulations to a number of track athletes who also placed first at states. And also congratulations to our boys soccer team for wrapping up their season in the semifinals or finals. I'm not sure which one. But irregardless, congratulations to those teams, and hopefully we can, formally recognize our athletes once summer comes to an end. Though I do recognize that it would be difficult for those who have just graduated. I also wanted to say thank you to so many community members who have been reaching out to us regarding masks or no masks, as well as other hot topics right now in education. And I think that communication is essential right now. And so if there are questions within our community regarding masks or changes for the school year, I think it's very important for you to reach out to a school board member rather than making assumptions based on what we're hearing other counties are doing. So I highly encourage the open communication within our community. And I think that's it.
Okay, so I actually just wanted to recognize Mr. Merrick. He is in attendance today. He is our new principal at Boyce Elementary, so welcome. We are so excited to have you and are definitely looking forward to working with you this year. So I want to say good luck, but I don't mean it as like it's going to be a terrible thing, meaning like good luck, that type of thing. Okay. May I have a motion to convene to closed session?
I move to convene a closed session to discuss personnel matters, including appointments and resignations pursuant to Code of Virginia 2.2-3711A1. The estimated time required for the closed session is 10 minutes and action is expected.
May I have a second?
Second.
All in favor?
Aye.
Aye.
All opposed? He's ready? Okay. May I have a motion to reconvene in open session?
I move to reconvene in open session.
May I have a second?
Second.
All in favor?
Aye.
All opposed? Certification?
Pursuant to Code Section 2.2-3712D of the Code of Virginia, how you certify. Ms. Kerhover?
Aye.
Ms. Ryan?
Aye.
Mr. Shooty?
Aye.
Ms. Singh Smith?
Aye.
Thank you.
May I have a motion on our action for closed session?
I move to approve the personnel, wait, is that right? Agenda as presented.
Is there a second?
Second.
All in favor?
Aye.
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 All opposed? Okay, I will adjourn the meeting. Thanks so much. Thanks, Katie, and
Aye.
enjoy your
All right.
vacation.
Thank you.
Bye.
Bye.